Students B. La visa de un estudiante. Él es una estudiante médica, describe su curso. Estoy terminando mi primer año de medicina. Lo que me gusta acerca de este curso es que estás envuelto con los pacientes desde muy al comienzo. Incluso en nuestro primer año estuvimos un tiempo en el hospital. Muchos de los cursos son PBL. Tenemos 2 sesiones de 2 horas a la semana donde trabajamos en grupos de 8 a 10 para resolver problemas clínicos. Decidimos juntos cómo taclear el problema. Buscamos libros y recursos online, en línea. Hacemos notas y discutimos el caso juntos. Es una gran manera de aprender y llevarnos con los otros estudiantes. En el pasado los estudiantes médicos tenían lecturas con toda la clase tomando notas de personas de lectura de 9 a 5, pero ahora es principalmente trabajo en grupo. Aunque no tenemos aunque sí tenemos algunas lecturas de seminarios donde trabajamos en grupos pequeños con un tutor, me gusta todo de esto, incluyendo las disecciones, que es cuando ocultamos cadáveres, desde el segundo mes del curso. Match these activities to the stages of medical education in the UK, giving an A opposite, dissecting cadavers, undergraduates, keeping a log of surgical procedures observed and performed postgraduate, working for 4 months in accident and emergency to experience this specialty, foundation program, taking a 4-week attachment in obstetrics and gynecologist, clinical attachment, taking an online course on recent developments in cardiovascular disease, continuing professional development. Complete the sentences, look at B and C and opposite to help you. Just before the final year, the students have the chance to take an elective in a hospital in their choice anywhere in the world. Problem-based training contrasts with an approach where each subject is taught separately. These days on PBL are often interactive with regular opportunities for the students to ask questions. In clinical skills, students learn how to treat and manage patients. And student-selected models can be a topic from outside medicine, such as foreign language. Dissection of cadavers is an important part of the anatomy component. The Bachelor of Medicine at the University of Edinburgh is one of the oldest in the UK. This specialist at the Royal, one of the leading pediatric heart specialists in the country. The Royal College of Surgeons in Edinburgh dates from 1505. We have a seminar each week where we discuss topics in a small group with our lecturer. Match each of these activities to one of the components of the undergraduate course describing BNC opposite. Julie spent 6 weeks working in a small hospital in the Himalayas. Students selected. A group of students discussed together the possible reasons for abdominal pain after meals in an obese 44-year-old male, PBL. A small group of students traced the pulmonary artery in the cadaver dissection. Otto spent some months working in the pediatric ward of the local hospital, clinical attachment, and learned how to take blood from elderly patients. Vocational students. Yuma chooses to study travel medicine in his 4th year. Students selected models. Um, 12 Medical Education Foundation Program is a 2-year training program which forms the bridge between the university level study as a medical school and a specialist or general practice training. Consists of a series of placements each lasting 4 months, which allow the junior doctor known as a trainee to sample different specialties, for example, pediatrics. A year 1 trainee FY1 corresponds to pre-registration house officer PRHO post a year, and a year 2 trainee FY2 to senior house officer SHO post. Each trainee has an educational supervisor who ensures that more senior doctors deliver training in different ways, including clinical and educational supervision to progress trainees have to demonstrate a range of clinical competencies which are assessed through observation in the workplace. People in medical education. Tutor, an academic or in some cases a postgraduate student who leads tutorial demonstrator and anatomy teaching is someone who demonstrates how to dissect. Demonstrators are often postgraduate students paying their way through medical schools. Lecturer, senior lecturer, and an academic with teaching and research responsibility who contributes to the teaching of a particular discipline. Professor, a senior academic with teaching and research responsibilities for a particular discipline, usually a leading figure in their discipline. College tutor, a consultant responsible for delivering a college training program. Clinical trainer, a consultant assigned to the trainee who provides training during periods of direct clinical care. Educational supervisor, a consultant who supervises a trainee period of training. Medical qualification, BMSc, BMSCI, Bachelor of Medical Sciences, a degree often taken after 3 years of medical studies by students who may wish to follow a career in medical research. MBCHP, MEBBS, BMBCH, BMBS, Bachelor of Medicine, Bachelor of Surgery. Bachelor degrees are undergraduate degrees. This is the first degree for UK doctors. MDDM, Doctor of Medicine. DRCOG, Diploma of the Royal College of Obstetrics and Gynecology. MRCP, MRCS, member of the Royal College of Physicians. A member of the Royal College of Surgeons. Doctors become members by successfully completing the assessment procedures in the college. VRCS. ED class and VRCSI, Fellow of the Royal College of Surgeons in England. Other colleges are indicated by the letters which follow. For example, Edinburgh, Glasgow, or Ireland. How doctors become a fellow depends on their college. For the FRCS, further examination must be passed. For other colleges, it is by nomination or work assessment. El programa de fundación. El programa de fundación es un programa de entrenamiento de 2 años que forma el puente entre el nivel de estudio de la universidad en la escuela de médico y el entrenamiento de práctica general y especialista. Consiste en una serie de colocamientos, cada uno dura 4 meses, que permite al doctor menor o junior, conocido como entrenante, para diferentes especialidades, por ejemplo, pediatría. El entrenado de 1 año corresponde a la casa de preregistración y el entrenado de 2 años responde a la casa más avanzada. Cada entrenado tiene un supervisor educacional que se asegura de que los doctores entrenen de diferentes maneras, incluyendo clínica, con supervisión clínica y educacional. Para progresar, los entrenados tienen que demostrar un rango de competencias clínicas, los cuales son asignados por observación en su lugar de trabajo. Personas en educación médica, un tutor es un académico, en algunos casos un posgraduado estudiante que manda los tutoriales de mostrador enseñando anatomía, en que demuestra cómo disecar. Los mostradores son frecuentemente posgraduados estudiantes pagando su camino a través de la escuela médica. El lecturador o el señor lecturador es un académico enseñante y que investiga responsabilidades que contribuyen al enseñamiento de una particular disciplina. Profesor, un señor académico que manda investigar responsabilidades para una disciplina en particular, usualmente como la figura liderante en esa disciplina. Tutor de universidad es un consultante responsable para llegar o deliberar los programas de entrenamientos en universidades. Entrenador clínico es un consultante asignado a un entrenado que provee entrenamiento durante periodo de directo cuidado clínico. Supervisor educacional es un consultante que supervisa a un entrenado por un periodo de tiempo. Calificaciones médicas: BMSC, BMED-SCI. Graduado de Ciencias Médicas es un grado muy frecuente tomado después de los 3 años de estudios médicos por estudiantes que desean seguir una carrera en la investigación médica. MBCHB, MBBS, BMBCH, BMBS, graduado de medicina, graduado de cirugía. Estos son graduados antes graduados. Este es el primer diploma, primer grado para los doctores de Reino Unido. MDDM, doctor en medicina. DRCOG, diploma del Real Colegio de Obstetricia y Ginecología. MRCP, MRCS, miembro del Colegio Real de Doctores o el Colegio de Cirujanos. Los doctores se vuelven miembros ya haciendo completando todo bien las asignaciones o procedimientos de su universidad. FRCSS, FRCSI, y GLAS es miembro del Real Colegio de Cirugías de Inglaterra. Otras universidades son indicadas por cartas que le siguen, por ejemplo, Edimburgo, Glasgow o Irlanda. Como los doctores se vuelven miembros depende de su universidad. Por ejemplo, los FRCC, todas las asignaciones deben estar pasadas. Para otras universidades es por nominaciones o trabajos asignados. Complete the phrases with verbs from the box. True phrases can be completed in 2 different ways. Look at A and B opposite to help you. Demonstrate a competence or how to do something. Supervise the trainee, ensuring to successfully complete their training. Deliver a course or training of program as a teacher, take a course or training program as a student, assess progress or competence. Match the two parts of the sentences, look at A, B, and C on opposite to help you. A body of specialists responsible for delivering and assessing training of their specialty is a college. Are responsible for the training in the first year of the foundation program is FY1 is a doctor. Who provides training during periods of direct clinical care. A clinical trainee is a consultant who teaches dissection, and demonstrator is an anatomy teacher. Writing full qualification of the doctor and surgeons, look at C opposite to help you. Mr. A.H. Young Husband, MB, MBCHB of FRCS, FRCSI, Bachelor of Medicine, Fellow of the Royal College of Surgeons of England and Ireland. Dr. C. Doyle, BMed, SCI, DM, MRCP, Bachelor of Medical Sciences, Doctor of Medicine, member of the Royal College of Physicians. Dr. E. Meriwether, BM, MD, FRCP, Bachelor of Medicine, Doctor of Medicine, Fellow of the Royal College. The overseas doctor. Oh well. What kind of registration might these doctors obtain? Look at the opposite to help you. A newly qualified Spanish doctor, provisional registration, limited registration, a doctor who successfully completed the first foundation year for one full registration, and show who has successfully completed the foundation program and again a certificate of completion of training after several specialist registered post specialist registration. Write the abbreviation in words. Look can be A, B, and C opposite to help you. Any doctor who wants to work in the UK must register with the GMC, General Medical Council. Some overseas doctors must pass the PLAB test before they can register. Professional Linguistic Assessment Board. Part 2 of the test consists of an OSCE, Objective Structured Clinical Examination. In early emergency, remember the ABC protocol, airways, breathing, and circulation. Before you can obtain the specialist registration, you have a CCT, Certificate of Completion of Training. Complete the text, look at A, B, and C opposite to help you. My name is Musa and I come from Germany and I came to UK about 2 years ago after graduating. Because Germany is inside the EEA, I could only obtain the limited registration with the PLAB at first. It was very difficult for me to obtain a place on the foundation program. Although I speak English, I had to take the PLAB test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that counseling, that medical, you shouldn't simply memorize a set of phrases. It's better to really think about what you're saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain the full registration, but I found it difficult to get a show. Plus, it may choose a specialty pediatrics as hospital now how to demonstrate there is a suitable candidate from the EEA. Once I've completed my second foundation year, I shall obtain the provisional which allow me to proceed with the specialist registration with the DMC, an important step on the road to becoming a pediatric consultant.